I'm speaking with Dr. Jadine Anderson, who is a chiropractor. Let's talk about the ergonomics of cars. Are we sitting in our cars correctly? How about car seats?
hmm In lots of cases, what I tell patients or friends is when you're trying to adjust your car seat, depending on the type of car, I know some of them the bottom seat is really close to the floor and they're not elevated like in a SUV or a pickup truck. In those cases, I recommend not having the back be much past 90 degrees because the further back you are, it puts more pressure on your low back and your muscles to help hold you upright as well. So I try to say just about 5 degrees past 90 is a good area to have your car seat tilted back. And then if you're on a low riding car, it's hard to change the angle of the front or the bottom cushion. But if you're in an SUV, I know some of them you can angle how the seat sits. And what I would have people do is angle it so the front of the bottom cushion is a little bit higher than the back, maybe about 5 degrees as well. And that'll just help form your low back as well. And if there is a lumbar cushion support, to always have that forward, because that'll help keep your low back in its proper position.
Well, that's a good suggestion. How about car seats? Are they okay?
Car seats for children, in lots of cases, you need to form a little bit of lumbar support even for an infant or young kids as well, because they sit in those seats just as long and sometimes longer than the parent. So having the proper support for their low back is just as important. You can use some thicker foam to cut about the right length to fit your child, and sit in there to where that's going to help keep their low back in the proper alignment as well.
So add to the car seat, add the foam to the car seat.
Yes.
To create good alignment for the baby.
Yes.
For the little one. Okay.
And in some cases, I even tell patients to use a pillow to help prop the child's head, so they have a tendency to sway from side to side, to minimize that as much as possible. Because I guess I always ask them, if you wake up and you were sleeping with your head cocked to one side for a long time, your neck's gonna have some aches from that as well.
Very good. Thank you, Dr. Anderson.